today, laser basics, what a laser does, and then we're going to do our hands-on with that. So laser, what does a laser mean? And there is your definition. So when you see the word radiation, you think about not using lasers around pregnant people, people with pacemakers, things like that. It's actually not the case. Lasers are thought of like light energy, so just like sitting under a light. So you can use them with any patients. There is no restrictions. Albert Einstein invented laser energy. This was before he invented it, and that's him after. We're going to go through a little bit of the evolution of lasers. Some of you, anybody have a big bulky laser in their office that they got a long time ago? Anyone? No? Okay, they used to look like this. They were about $35,000. They looked like microwaves. They were huge. I won't go too much into this, but as you can see over time, they got smaller, less expensive, more portable, and then we get to 2008, the Styla came out, which is the same laser as we have back there, completely portable. It looks like a handpiece. It is activated by a wireless foot pedal, and that pricing is about half of that now. It's $5,000 now. So if you guys think about that versus back in 1994, we've come a long way in lasers. What that means to you is that they are becoming a lot more popular in offices. You guys are lucky because you're in California, so your hygiene staff can also use lasers, as well as the doctor. What does a laser do? So a laser cuts, coagulates, cauterizes, and sterilizes as it works. So what that means to you is that you're not getting any blood. Now I won't say no blood at all because you all have those patients that you touch their gums and they bleed. So it's not a magic wand, but it does cauterize and coagulate, so the blood is very minimal. Now we're talking about versus like scalpels, electrosurge, things like that. Do you guys use electrosurge in here? Any doctors? No? So the advantages of a laser. Minimal bleeding, minimal post-op discomfort, predictable results. I'll give you a little background. Electrosurge users, which is what most doctors are doing if they're not just using a scalpel, electrosurge goes 800 to 1,000 cell layers. So if you think about every time you're touching the tissue with that, it's going down 800 to 1,000 cell layers. The research behind a laser is 2 to 5 cell layers. So your pain is obviously less, and then your recovery time is much less because you're only taking away what you just touched, not anything deeper. And that brings us to no recession. It's precise because it's only cutting what you're touching. Faster healing. No tissue scarring. Less, we say less because some doctors like to use this anyway, but 98% of the time you're just using topical with lasers. If we get into things like frenectomies, that's a little bit more advanced and we probably would use the local, but most cases you are just going to use topical, which is a huge advantage. You don't have to numb your patient, you don't have to wait, all of that. Lasers are meant to make us faster in our everyday office. Patients accept it. Great to treat periodontal disease. So this is huge. It's becoming huge in California because your hygiene staff can use it. You don't have to take away doctor time. And we'll go over that a little bit later in the presentation. It's simple. As you guys saw, it looks like a pen. So there is no footprint on your desk. We do have another version that is kind of like a laptop. It's small, it's back there. But that one also unplugs and becomes portable. different wavelengths, and it really, really confuses people. There's 3 different ones out there. There's 980, 940, and 810. What that means to you is, that one, basically what the lasers are attracted to. All 3 of those are attracted to melanin, hemoglobin, and water. So what the different wavelengths mean is where they're attracted to the different things. So as you can see, ours, the 810, is first attracted to blood, then skin, then water. Meaning that you can work in a dry field or a wet field, doesn't really matter. When you get to the different lasers out there, all it means is they're attracted to different things first, meaning they need a little bit more power to get through the water. So there's a lot out there where people are like, I don't want to get a laser because I'm just confused. All these wavelengths, on your everyday life, it means nothing. Under a microscope, it's going to mean something. So think about it like that. It's really just a marketing thing from the different laser companies. So laser energy, 4 things can happen. It's either reflected, transmitted, scattered, or absorbed. So what we're going to look at is the last one, because you're actually touching with our lasers, and most diode lasers. So you touch the skin, so the only area that the laser is going to is where you're touching. So here's some images for you. This is somebody who had abscesses grown over their teeth. This is after. So the laser removed all of that tissue. You can see that it's not all black, bloody, all of that. It's completely removed it. Now it did not do the bone. These lasers only do soft tissue. So the bone was still done with a drill. The outside, all of that was done with a laser. So you guys aren't going to be able to see this, probably most of you, but I have it printed out for you. So these are FDA cleared applications. You'll be amazed what you can do with a laser. The number 1 thing doctors use lasers for, general dentists, would be the laser troughing. So instead of packing cord, you're going to use the laser. Takes you 10 seconds, you go around the tooth, you're done, there's no blood, you don't have to wait, and then in 48 hours that tissue is back because you only took away a few cells, if you remember. So other things, exposure of unerupted teeth, so this is probably something Dr. Linsky is going to use her laser for. You have kids that come in your office and they want braces, but their teeth aren't exposed. You can just make a window with the laser. Takes you 10 seconds, put a bracket on it, pull it down. You didn't have to wait. Frenectomies, you can get rid of the frenos with this. That would probably be the one you would use local. Gingival troughing. Gingivectomies is also a huge one. Smile design cases, huge with lasers because what you see is what you get. It's not like a scalpel or once you're done, you're not really sure where it's going to end up. When they leave the office, that's what they're going to look like in a week when you recall them. Implant recovery. Lasers can be used around bone, enamel, metal. It doesn't matter. They can touch all of it, which is a huge advantage if you use electrosurge. Let's see what else is. Laser curettage. So that would be something for the hygiene team. It's basically what they're doing is going into the pocket. Lasers are attracted, number 1, to melanin. So our laser is. So at a very, very low setting, what it's going to do, diseased tissue is darker. So when you go in there at 0.4, which is really low, it's only going to remove the diseased tissue out. So your hygienist, it's amazing. If you guys look at it, it's basically like sticking a toothpick in a cake, put it in there, you come back out, you have a little bit of tissue. If you put it in there and you don't have anything, you're good to move on to the next one. Huge research behind that too, and it's becoming really, really popular. Along with this last one, removal of diseased, infected, and inflamed soft tissue in the cradle and the pocket. So that's something you would do blood pockets. This is amazing. So I'll give you some pictures up here, but we'll go into them individually in the next slide. So laser troughing, this is what I said, number one reason doctors get lasers. So as you can see at the top image, okay guys, we're back up. Okay, so laser troughing, the very top picture is an image of the laser troughing around the margins. You can see there's no blood, a little bit of tissue's gone, perfect impressions at the bottom. So you guys don't really care about settings, but benefits, predictable margins, no tissue recession, no bleeding, no discomfort, faster procedure. So you're not sitting there waiting for them to stop bleeding. It's fast, easy, not having to retake impressions. So that's the number one reason general doctors buy laser. Number two is going to be gingivectomy. So here is an image. And this is right after. So you'll see there's a little bit of brown. That's where the laser took away the tissue.
How long does that stay like that?
It stays
like the brown, like 24 hours? Or?
No, right after you're done, you can take hydrogen peroxide, wipe it on there, and it's gone. That's just a little bit of tissue left over, so you wipe it off. They walk out. They already look great. In 48 to 72 hours, they're completely healed. There is 48 hours after.
Do you do any like home care, special home care, just salt water, nothing? Just brush and floss normal?
Yeah, we don't recommend brushing the night up. That's the only thing. So they can rinse with anything, but they have a full mouth done. The brushing's going to irritate it. So I know that goes against dentists, but
Brush before it.
yeah, brush before. So your benefits here are predictable results. There's no recession, no bleeding, no discomfort. Frenectomy, this is one that is huge also.
We do it.
Here's your picture. So no sutures, no bleeding, no discomfort, and no injections.
Wow.
Can you guys all see those pictures back there? Yeah. And there is 48, 72 hours after. Kind of a bad photo. It's there. Implant recovery. So this is those patients that wait too long to come back in and their skin grows over. So you can touch metal. So you just take the laser, remove the tissue that's over it, over the implant, and you're ready to go. So here there's no sparks, no heating of the